Welcome to the Dining Executive Council Fall Webinar Series. I'm really excited today that this is the first webinar in the series that we're doing, and the topic for today is navigating the food service supply chain during COVID-19. For those of you who may not know me, my name is Meagan Pollak-Harrison, and I have been with Direct Supply, specifically DSSI, for over 13 years now. Man, I can't believe how time flies. And really have been focused specifically on our food service products and consulting that entire time. Really have a strong passion for food and nutrition and dining and senior living and healthcare. So excited to be able to be the moderator for our panel today. Before we get started, I'd just like to note that the information contained in this presentation is intended to provide general information, but not advice about certain regulations or initiatives. This is not intended to be legal or other advice, and each situation may vary depending on particular facts and circumstances. You should not act upon this information without first consulting with qualified legal counsel. So now that I got some of the legal and housekeeping pieces out of the way, I'm excited to get into a little bit more of the content. As some of you have attended our dining executive councils in the past, generally we like to meet in person. It is one of my favorite events that I look forward to every year, and this would have marked our 5th anniversary together. So I'm really sad that we're not going to be together in person, but hopefully we can take some time today. We'll do our best to make the session a little bit interactive. And of course, you all get to see me sporting the latest COVID accessory, which is the headset for these Zoom meetings. I was hoping to get to wear my cool Apple earbuds, but the sound wasn't as good, so I get to sport my new headband today. With that, I kind of thought it would be fun to start out with a food-focused polling session. So I'm not sure about you guys. I know personally myself, through the start of quarantine, especially, I did not stick with my healthy habits. And why don't you share with us what your biggest vice was during quarantine here? Did you enjoy too many of the sweet treats? Were you more, this was probably mine, some of the salty snacks? Did you help support some of the restaurants and do quite a bit of takeout versus cooking from home? Or were you one of those people that was really able to stick to your healthy habits that you have maintained pre-COVID? And in this, I also, I maybe should have added wine in here. I know some people like to indulge in that over COVID, but we didn't want to call anyone out there either. And man, just sitting here in front of my camera, I just miss being on stage, and more importantly, getting to have our post-presentation events and networking with all of you. So hopefully this time next year, and instead of me having to be presenting live from my new home office, I'll be able to be enjoying a nice glass of wine and some food competition with this group. And for those of you who maybe haven't attended a Dining Executive Council meeting in person in the past, hopefully you'll enjoy this webinar series that we're being able to do as an alternate, and you'll be able to join us in person next year. And we'll see what everyone's biggest vice was during quarantine. I know we have some registered dietitians who participate. Me being one myself, you would have thought I would have kept with my healthy habits because I know better, but I didn't. All right, well, we have a little over 200 attendees on at the moment, and it looks like the biggest vice of everyone were the sweet treats. So it looks like everyone had a little bit more of a sweet tooth. Coming in next, really supporting those restaurants still with too much takeout, followed up by the salty snacks, and then about 22 of you who responded kept your healthy habits. So props to you on being able to do that. Well, in addition to some of those healthy habits really being disrupted during COVID-19, I know COVID-19 and the current state of The pandemic really has disrupted a lot of us in our personal lives and our professional lives. As I mentioned, just that we have to have a webinar together today versus gathering in person, which I know many of us just really love to do. But that's really why we felt that as the Dining Executive Council Board got together, which is made up with some internal partners here at Direct Supply and a variety of providers really representing different areas of dining and nutrition operations within their organization, we really felt that this webinar would be very valuable to you. And we had a great registration amount, so happy that all of you are joining us here today. And really the topic of today, we're going to be exploring how the food service supply chain partners have had to adjust their business practices really to support the senior living customers through COVID-19. During our time together today, our panelists will answer questions around menu development, manufacturing, distribution, and how things have had to adjust and maybe what trends they see staying going forward. Really excited. We have a terrific panel and just their years of experience brought together. They have been working in healthcare food service for over 65 years. And I'm really excited for each of them to introduce themselves and really just share their unique perspective on menu development, manufacturing, and broadline distribution. So without further ado, I will turn it over and let each of the panelists start to introduce themselves.
Absolutely. Thank you, Megan. My name is Barb Minger. I am a registered dietitian. I work at Gordon Foodservice, and I am their business solutions specialist supporting healthcare and education segments for them. I have been in the industry, specifically at Gordon's, in a variety of capacities for over 19 years. I'm happy to be here. Thank you, Megan.
Great. Welcome. Thanks for joining. We're really excited to have you, Barb. And Nick, why don't you go next, please?
All right. Good afternoon, everybody. I'm Nick Kruthaupt with Sysco. I've been with Sysco 28 years. I am the Vice President of National Sales for our healthcare, senior living, government, military, higher education segment. So glad to be here and the conversation today.
Excellent. Thanks, Nick. And we're really excited to have you as well. And last and certainly not least, Scott, if you can introduce yourself and share a little bit about your background with the attendees.
Yeah, good afternoon, everybody. My name is Scott Ware. I work with Tyson Foods, been with Tyson for 16 years now, and in the channel development, channel marketing space. I am not a dietitian. I'm married to one, if that helps. It is funny that we met in college, and as a business major, never thought that our paths would intertwine in what we did from a career standpoint. And we do have conversations at home a lot of time where I'm asking her questions as she works in this space. And so very glad to be here. And on behalf of the panel here, we just want to thank each of you for what you guys do every day.
Awesome. Well, thank you all. I'm really excited. And the panelists, we actually have met a couple of times as we've received some questions in from you as the attendees and providers, so that we're really hoping to narrow in on some areas of focus that you are really interested in around the supply chain and menu changes that we've seen. So really just from a high level, getting started on some of those topics. Barb, since we started with you in intros, I'll toss it out to you first. Just really from your high level perspective, can you share some of the areas of your business that you maybe see returning to normal as far as menu development goes? And what changes and trends do you maybe see sticking around for a year plus? I'd love your perspective just kind of from a high level on what your world is right now.
Sure. Certainly have been more changes than we can possibly imagine, right? Certainly it's been a wild ride, and we've seen, evolvement happening, in the menu space, in terms of, which we'll talk a lot about today, in terms of supply chain, right? We really want customers to be comfortable with what they're offering, to their patrons. And it's, really, and we're going to talk more about this, but labor has certainly driven a little bit of that. It's certainly because of COVID and how much labor you actually have in the building. We've looked at the menu being very convenient. It's definitely gone to more of a convenient style. But we still, as we're going to talk about, very, very important that it's pleasing to the residents. So we've looked at simple recipes and certainly some packaged items. But from a high level, I feel like now people are really getting into the groove. We're going to hear, to me, we talk about the new normal. We look at the next normal, right? We need to look at this in terms of what this is really like for the resident or patient, and make sure it's a pleasing experience.
Yeah, definitely. I think in a lot of the conversations I've had, whether it's with some of the supply chain partners or providers, I think everyone talks that things are not going to go back to quote unquote normal, and it's definitely going to be a new normal that we're going to see going forward. So Scott, why don't I go with you next? And if you could kind of, from the same perspective, really share just your high level view from a manufacturer and Tyson of some of what you may see returning to a little bit more normal, or what you may see in some of those trends maintaining going forward.
Yeah, I'll start with big picture food service first, and then kind of scale it down maybe into more of this space. But overarching, some of the trends that we're seeing is anything that fits within the delivery or digital ordering space. Those across food service, those are actually maintained and sustain their business fairly well over this COVID situation. So think the best people that do that are like pizza players, and they've actually maintained their business pretty well over this. As you scale down into maybe more specific to the space we're in here, if you look at things like scaling down the menu and utilizing the core piece menu items that we have, you're seeing that across all channels though right now, of just kind of tailoring that down across all spaces as well, more price value offerings. And then, as Barb mentioned, something that we are absolutely seeing across almost every channel within food service is this prepackaged IW, and I'll say from a manufacturer standpoint, those items that we have typically sold in retail, we're getting so many more requests from customers in the food service side saying, are these products available? So think things like you'd buy in the grocery store as a meal kit that we could offer to employees as they go home. They might not be able to go stop to the grocery store and get something to eat. So a meal kit that they could take home and provide, or things like that. We're getting more requests, and those are trends that we absolutely see staying long-term after this.
Great, thanks for sharing that insight. And Nick, if you can please share kind of that same perspective from you at Sysco and as a distributor.
Certainly. So, first I want to reiterate what Scott had said earlier. I want to thank the providers for all the work they do on the front end and all their associates and what they're having to do. We know it's tough. So we appreciate you very much. In terms of, it's difficult to predict the future. So the immediate effect to distributors, and I'll say this, generically, was about a 60% drop in our sales, because of the restaurant closings. And you think about all the travel and leisure effect and all of the sports entertainment and everything. So it's come back. There's been reopenings. A lot of that's driven by, local and state governments, what they're allowing them to do. We're close back to pre-COVID levels. So, as Scott mentioned, we see a lot of a shift of buying habits from bulk items to the PCs. And at the same time, the food service industry and distributors lost that business. It basically shifted to the grocery stores. And so the grocery stores started pulling that many more products from suppliers like Tyson, and that drug our supply chain down. So I don't think we're in a position to make predictions. I think we slowly see it. We don't see a big bounce back, more of a crawl back with the reopenings, and we're staying on top of that.
Yeah, I think that's a great point, Nick. think no one can really predict much. Sometimes we thought we could maybe even guess a month from now. And I think maybe now, maybe we understand a week from now a little bit better, but talking to folks, things were changing for many of you listening in today that I've chatted with sometimes daily and even by the hour, depending on how COVID was impacting your buildings in some of the regions of the country. So thank you for that high level perspective. It ties in great as we dive into the questions. We'll see reoccurring themes around menu development, around the impact on stocking and product availability, and really some of the pricing trends that the panelists just talked about at a high level here today. So with that, I want to jump into our next polling question. Really, we want to hear from all of you that while you were managing the pandemic, really in the height of it or even currently, what menu changes did you make? Did you implement a convenience or a crisis menu where you had an outbreak, you maybe implemented a crisis menu just for ease of use and maybe where products were available everywhere? Did you keep your regular menu but adjusted some of the ingredients to use some of the convenience items that we just briefly talked about? Or did you keep your regular menu and you just tried to use the same standard ingredients as much as possible that you were using before? And I want to give a quick shout out to Kim Matisco. She's one of our fabulous reporting gurus and analysts here at DSSI. And she pulled some really interesting data for me to share with you throughout the presentation today. And really wanted to take a look because we know in addition to your operations changing from a menu perspective, we know there was a significant change for all of you in really how you had to deliver that meal service. So she ran some numbers just to kind of showcase where some of those changes were. We ran these numbers really from November, and they were as current as of Saturday, just a couple days ago. And you can see in that time frame, really, there's been an increased usage of disposables by about 85%. Also, there was a big surge in purchases of overbed tables with having to shut down a lot of the communal dining room spaces and having residents eat in their rooms. A lot of you had to purchase overbed tables for those residents to be able to eat in their rooms. And what a difference and change in experience for them. There were some new dining trends. We talk about those in the Dining Executive Council meetings. I'm sure you talk about them with the other supply chain partners throughout the year. Just some of the different ways that food service delivery carts or action stations and things like that tick in meal delivery, but also interesting, the food service non-disposables, there was a significant drop. So maybe having to replace some of the china, things like that you're maybe doing during these times, you weren't having to do as much because you had an increase in those disposables that you were using. So just thought this was some interesting data to share. And as we had just talked about in that initial panel discussion, really not being able to predict trends from day to day, when COVID really started to hit more prominently within senior living in our industry, you can see back in March that there was a 378% spike in the use of disposables. And as people have continued to pivot and adjust, and we're learning things on infection prevention and what some of those best practices are, we have seen that drop off quite a bit. But you can still see in this chart here that it's still up 105% from kind of that pre-COVID timeframe from back in the first part of November. And we're actually, the second webinar in the DEC series is on infection prevention in your dining practices. So please join us next month to get into a little bit more detail on that, but thought this might be interesting to share with the group. And with that, I think our polling numbers have come in here. So thank you all for sharing that. And really, most of what we heard from at least the attendees on the call is you had gone with option C, where you had made some adjustments to your menu, and option D, where you kept your regular menu ingredients as much as possible. So I think that's great insight as we continue to move forward and jump into our next set of questions, really focusing on the menu with our panel. So Barb, coming back to you again first here, and I guess ladies first a little bit here today. And can you share with your experience in the menu development, really what you have seen some of your providers as they've had to make some adjustments going to a crisis menu. Again, you touched a little bit on labor and some of the crisis outbreaks. So please give us a little bit more in-depth perspective on that. Absolutely.
Yeah, certainly it's been, as I said earlier, challenging. And early in the pandemic, I almost felt like, certainly people went to an emergency type menu because of the COVID affecting their labor. And so, but what that meant is it was really, they turned to the 3 to 7 day emergency menu that they had, always thought about. But in terms of that really is a short term, maybe a power outage or a water issue or something. So we were then charged with creating more of a convenience type menu for our customers, and understanding that it, to the point of your survey, which confirmed that, we still wanted to keep that, regular type menu as much as possible because of the quality to the resident and patients. So what that meant was just working with operators to revise menus based on availability of the product in the market. And, as it continued to fluctuate, looking at supply and demand, there was certainly a very high demand for a short period of time, especially for shelf stable and frozen meals. Maybe it was for floor stock. Maybe it was for, maybe it was for employees, just because they couldn't get out of the building, things like that. So we saw certainly demand in a market that our manufacturers could not keep up with for quite a few months there at the beginning. But in terms of the menu itself for patients or residents, overall, we created that convenience menu, but it ended up being exactly what your survey said. It was a combination of the regular menu with convenient items worked in based on what we could get our hands on and what we could help them with. And overall, it was an amazing, both Nick and Scott have mentioned, we have to thank our operators for the patience and, working with us on those kinds of things to make the experience as best as we can, for the people they were serving. So
great. Thanks for that perspective on what you've seen around some of the menus. I know with that, and I touched on it a little bit on some of the data that we shared, there's been some depression with some of the isolation, or it's just hard with the isolation. I know mealtime is such a highlight of many of the residents' days, and talking with some of the providers, you as attendees, just some of the concerns around resident outcomes and nutrition status. Barb, kind of piggybacking off some of the menu comments, can you add any insight if there has been any additional things or things that you've seen to help combat that or ensure that we don't have some of that unintended weight loss that we're always so concerned about in our industry?
Absolutely. Personal passion of mine, obviously. The dining experience is everything to everyone, right? And when we took that away and people had really strived for years, right, to do a restaurant style dining experience in long-term care or room service and acute care, whatever it might be, all of a sudden overnight, everybody was staying in their rooms. And so that decrease probably in overall, family and friend contact, as well as, just dining satisfaction, leads to malnutrition and dehydration. It's we've seen it over and over again. So what we've done, the menu development in that area has been revolved more around, creating excitement during the mealtime, whether it be in the in-room dining with, you mentioned a little bit ago, beverage carts and theme carts, and, understanding that it is truly still a dining experience. So if it's in room, then how is that being executed? And did they have to purchase some equipment? What does the tray presentation look like? What does the service look like? So some training also for staff and those spaces, looking at building the communal dining experience then too, in those, depending on the state, the county that you live in, coming back around to, if at all, communal dining could be implemented back. What does that look like? Is it half of the building coming down at lunch, half the building coming down at dinner, just to get them out of the room once a day? Is it, you mentioned bedside tables. Is it bringing the bedside tables out to the dining room to extend the space at a table to create that social distancing? So they could still, be out, but maybe only 2 to a table, or using large activity rooms to extend spaces. anything that, and it's been a kind of a consulting process because every building looks different, but that, to your point, as far as outcomes, certainly can, really decrease weight loss if we can get that kind of camaraderie and experience to the communities.
Yeah, I think that's great insight, Barb. And again, as we've talked about topics to cover in this webinar series, I think that's one we may even have a whole entire webinar around, is just getting some more into the details. I know we're touching on quite a few different things at a very high level today, especially as this first webinar, but really what are some of those success stories that some of you as attendees and providers have had? So if you have some of those really creative ideas that Barb was touching on, please reach out to myself or other DEC members that we'd love to hear about that and be able to do best practice sharing. That's something that is so valuable at our normal in-person events. So we still want to be able to bring you those, just peer education and hear what some of your counterparts are doing really well. So thanks for that insight, Barb. Nick and Scott, I'm going to give you a chance now to jump in here. I know you had touched on it a little bit, just really the shift to the portion control and individually wrapped items. We saw it in the polling, just really some of the increased use of those convenience items. So Scott, why don't I turn it over to you to give some insight on what you've seen at Tyson of maybe some of those pre-made or individually wrapped items that you're seeing now on the food service side and in long-term care that you maybe hadn't seen before. If you could share insight, that'd be great.
Yeah, absolutely. This was a trend that we were noticing across all food service, but specifically even within senior living before COVID, of saying, hey, here's a trend of grab and go prepackaged that we see taking effect more and more. And then COVID hit, and as Barb said, overnight, we couldn't keep up with the demand that our customers were asking for within this category because it hit so hard so fast. But absolutely feel that this is a space that will maintain long-term. And our innovation, even as an organization, has shifted to say, because of COVID, to say, okay, how do we shift more to create and develop more grab and go, prepackaged, convenience style items that can meet our customers and consumers' needs on that. But that goes to, at Tyson, a couple of, examples of things, whether it be just easy things like we have that have been successful as the Hillshire small plates. That's a very easy item to grab and eat. Or I mentioned earlier, meal kits, things that we're seeing really take off in retail, but now we've seen success in the healthcare space, specifically targeting in the employees to give them meal offerings that we've started to see as an option. And anything, again, that can just be eaten on the go that falls within that. We have an entire portfolio of items I won't go into, but that space, without a doubt, you see our organization investing more going forward into what does the innovation look like, because we see it as a trend that is not going to stop.
Thanks, Scott. I know that's a key area of innovation is one that, for those who have heard me talk at the DEC events in the past, I have a passion for tech and innovation, and definitely in times like these, it's really fascinating to hear how different organizations are really pivoting and using some of that to meet the current demands, and again, carry some of those trends and new product lines going forward. So Nick, I'll turn it over to you if you can give a little bit larger perspective from the Bradliner outside of just some of those center of the plate items that we see from Tyson, what you're seeing for some of those convenience and pre-made items.
Well, yeah, and I'll go back to what I said earlier. It was interesting, just the dramatic drop in our sales on those business in general, and then the way the retail picked up, and they pulled a lot of those portion control and individually wrapped items, honestly, before we could get our hands on them. I think things are starting to level out now. The suppliers, our merchandising team is working very closely with our suppliers like Tyson and many others to make sure that we're meeting the demands of what's going on. Now, to predict the future, honestly, I hope that we get back to, a better culinary experience that our seniors were experiencing. I think pre-COVID. So many of our providers had such an emphasis on developing unique menus and unique items, and I'm hoping it gets back to that. Again, state and local government will drive a lot of that. In terms of another thing that's affected is disposables. So when the non-communal feeding had to happen and residents had to stay in their rooms, my goodness, Hinge containers, we couldn't keep them. But we worked very closely with our supplier they added 3 different lines in their plants just for disposable containers so that we could meet production or meet demand. And we've gotten there. Same way with the diet kits as well. So, we're looking forward to, some sense of normalcy, hopefully soon, and not as many pieces. Like Scott, we have some customers that make frozen meals and such, and it seems like there's been some pickup in that demand as well from those types of suppliers.
Great. Thank you for sharing that perspective. I think your comments on the containers really showed in the previous chart and graph that I had around disposable products. It was really fascinating to see how much that had just really increased. And so now, again, like I said, we want to keep it interactive with you in the audience. So we have another polling question out for you. If you can share your practices and operations within your organization while you were managing or have been having active cases in your building, what product changes did you make? Did you start using some of those PC products when you had previously been using bulk? Did you change to some of those pre-prepared versus scratch items maybe that you have been doing? Did you maybe make both of those changes? Or again, it sounded like a lot of you tried to kind of keep business as usual, unless maybe there were some requirements just because you weren't able to get some of the products you were normally had available to you. With that, we ran some data again through DSSI. It's great that we can pull in some macro level data. Again, those of you who know me, I kind of geek out on some of the analytics around food and nutrition here. But I thought it was interesting and really did hit. So you can see here, it is really aligning with some of the comments that we're hearing with the panelists around those convenience foods. You could see that there was a 2% increase. This time frame was just a little bit different. We had started in mid-March, right before the pandemic, and ran some numbers around that. It was before it was really hitting food service. When you're asking what we included in those convenience items, it is any of those pre-prepared, frozen, single-serve, portion control. If it was a pre-made chicken breast or protein instead of one that was fresh or frozen. So that's where you may see some of those drops, for example, in the center of the plate. So some folks I know are for infection prevention or labor issues, we're moving towards some of those pre-prepared foods. And so that's why you may see some of that decline in some of those categories. And we also know during this time frame that there has been a drop in census. So that may be why some of these other categories we've seen a decrease in as well. But just wanted to show you some of this data in case you found that to be interesting. But again, I think it aligns really, really nicely with what some of our panelists have been sharing of what they've been seeing around menu development, manufacturing, and distribution as far as it's impacting our industry. Let's see the poll here. Looks like a lot of you, again, did not make changes, or folks that did really applied both using the pre-made versus scratch and the portion control items. Both of the above, and a small percentage of you really just changed to those individual PCs. So thanks for sharing that perspective. Again, it's really interesting for me to see what each of you are doing, as well as the panelists as they're answering some of your questions today. And also as a reminder, if you do have questions, please chat them in directly to Meagan Klein. You can see her name in that chat section. And if we have some time, we'll be sure to pull in any of those questions for our panelists. So next, we're going to jump in. We've been talking about some of the products and changes. We'll jump into some of just the challenges or things that we've seen with product availability. So Nick, this question will come in for you. Can you share just some of your perspective on the differences in some of the fill rates pre and post COVID at the height of the pandemic, and where we're seeing some of those level out today? I think you've touched on some of the causes just with manufacturing and how things shifted to retail, but maybe some of the ways that you guys are recovering and how you're anticipating if COVID continues to rage on longer than all of us really, I think, anticipated it going, what you're doing to help mitigate that. So if you could share your perspective from the distributor.
Sure, certainly. Yeah. So as we all know, I mean, we had to react quickly to the drop in sales just because we had inventory built based on, sales that were 60% greater than what we all of a sudden had. So, and we were trying to prevent from, dumping fresh product and, in both center of the plate as well as produce. So we got past that and we made all of our inventory adjustments. What we immediately focused on, as I mentioned this earlier, was demand planning. So we worked with our customers with input from our VP&As, we call them, that work with our senior living customers, to look at what pre-COVID inventory looked like and how quickly could we get back to that. So, pre-COVID, our service levels were, I'll just say, excellent. I'm not going to use specific numbers. And then when we hit the bottom of the barrel, so to speak, during the ultimate part of the COVID, they were service levels were challenged. We have inched back up closely to where we were prior to that. And we did it based on communication, working with our merchandising team and our supply chain team, and them in turn with our suppliers like Tyson and so many others. One of the biggest complaints we had was ground beef, and somebody mentioned PC yogurt, a few minutes ago. We worked closely with those manufacturers to commit to them so that they could commit lines to us and get back to the level where our customers expect us to be. And so we're in a much better spot now. And suppliers are better and their fill rates, but I know that, and Scott maybe touch on this, but there are still plants that have labor issues where that slows down production. And there's been some SKUs that have been eliminated so that they can focus on the heavy duty usage items. So we've taken that into account as well. So I think we're at a spot not quite back to pre-COVID, but pretty darn close. And we're continuing to work with our team and listening to our customers to get there.
Great. Thank you for that insight, Nick. Really appreciate it. I think that ties in really well with the next question. And Scott, I'll start with you. I know some of the manufacturers and distributors have reduced the number of product lines or SKUs at times to really help with demand of certain products and changing things around. Can you share some of the perspective on what you may be doing with some of those product lines going forward, and any impact that may have on pricing and availability on some of the items that manufacturers are producing?
Yeah, in simplest terms, I mean, that's absolutely what we're going through right now of SKU rationalization. I mean, we're currently looking at eliminating hundreds of SKUs. Now, these are lower volume SKUs that really took up more time in production that weren't valuable for us in the sense of being able to then run our most common or most popular SKUs that we could get out to our customers. Because at the end of the day, that's what we were wanting to do, is what are the products that we can produce at the best speed in the plant to be able to get more product for our customers. So by eliminating some of those low volume, those ones that took more time in the plant to run, we're able to help with that. Now, that's helping with it. It's not ultimately solving it. And the reason for that is what Nick just talked about, is when we still do have across the industry, but even within our organization, there are plants and our facilities that are struggling with absenteeism through this COVID. And when that's still an issue that you have to work through, it does doesn't allow you to, you can eliminate as many SKUs as you want, but it still doesn't get to where you ultimately need to be, I guess is a good way of saying that. And so we are doing that. Again, we are SKU rating to get to our most popular items to help with this, though. Absolutely.
Okay, great. I think that's really interesting insight. And I love that we were able to get a manufacturer and distributor both on the line here to share how that's going. So Nick, can you share from the distributor's perspective? Also, if there's any SKU rationalization and if that's helping with some of the product availability or pricing pressures that we're seeing with COVID-19.
Yeah. So, I would say we're not really doing any SKU rationalization. We're working closely with our manufacturers. So as an example, we always work closely with our manufacturers, but in the day pre-COVID, we probably met with our key suppliers once every 2 weeks or once even a month sometimes. And now we're meeting with them daily and weekly. And we're talking about I'm sure we're having discussions with Tyson about what are the core products that we have to supply the industry and specifically the healthcare industry. So, we're working closely with our suppliers. And in terms of pricing, it's interesting, Meagan, certainly there was spikes in ground beef and egg and dairy and some of that. But all in all, what we're seeing is not huge cost inflation over the second quarter of 2020 versus 2019. The costs are pretty much in line as what they were pre-COVID and also, this time last year.
All right, great. Thanks for sharing that perspective. I know that's been a big question and area that a lot of folks have been navigating is just products have been changing in availability. So really great to hear your perspective on that. Another question around this, and Scott, you touched on it a little bit. I think it segues nice into this next area. And we know the providers have been having some challenges with labor, but I know a lot of folks have seen on the news, especially in a lot of the meat processing plants, concerns of outbreaks or how do you keep your staff safe to really help make sure that the food supply chain doesn't get disrupted. So I know you have a little bit that you want to share on that for the attendees.
Yeah, we thought we have a short video that we're going to show. I think it's 2 minutes, but it gives, I think, a picture's worth 1,000 words sometimes. So just being able to see what it looks like when you go into one of our facilities and what the team members, the process that they go through just to get into the building to work. But I will say this, just on behalf of Tyson, I wouldn't want to speak on any other manufacturer's behalf, but team member safety is without a doubt the number one priority for our leadership of our organization. That gets communicated daily. It is priority number 1, 2, and 3 for our company. And so there's a lot that we have invested to be able to ensure that our team members can come to work and feel safe about it.
We're at one of our Tyson Foods poultry processing facilities here in Springdale, Arkansas, and we want to take you through a tour and show you all of the safety measures that we're taking to protect our team members. So let's go ahead and go inside. So as our team members enter the facility, you'll see just one of the many hand sanitizer stations throughout the plant, and then it's inside to get your temperature taken. Before the start of every shift, team members' temperatures are taken with this walk-through temperature scanner. If their fever is 100.4 or greater, then a nurse takes another temporal scan. If that fever is still 100.4 or greater, that team member is sent home. This area is where our team members are also provided their required facial coverings, their masks for their work every single day. Also, they can take one from this area at the end of the day to go home. So in some of our common areas, you're going to see dividers inside of our break rooms. There's regular sanitizing happening throughout the facility at all times. We've also installed at some of our facilities UV air filters for yet another layer of health and safety for our team members. As you go into the plant floor inside of our facilities, you see there are some instances where social distancing is naturally occurring. In other areas, there are workstation dividers where team members are working closely together. You'll also see the required use of facial coverings, and in some cases, the plastic visors covering our team members' face. A final critical component to all of this is communication. Talking to our team members and using printed materials, digital signage, and just word of mouth to communicate the importance of all of these measures to keep themselves healthy and safe, not only at work, but as they go home and into the community.
Of our roughly 120,000 team members that we have at Tyson, roughly a third of them have already been tested, and we're continuing to do that testing and find ways to do it better so that hopefully we can find sooner in the process when those individuals that might be sick or have symptoms catching that. And so a big focus for us, as you can see from that.
Thanks, Scott. I think that was a really interesting video to see and share with the attendees. I know it was really interesting. You hear and you can maybe visualize it, but like you said, a picture is worth 1,000 words. So I think that was really great to share with everybody. Okay, so the final polling question is, with some of the changes to menus and convenient products, how have you adjusted your food budgets? Have you just increased it across all my communities? You only increased it when a community has an active COVID case? You're trying to keep it the same, or where you have an outbreak going on, you're not even considering budgets at this time. I know there's been cost increases in various areas of the business with having to increase the amount of PPE that you're purchasing for staff that maybe wasn't traditionally wearing it, or additional thermometers for temperature checks and things like that. So also it was great. Some folks had chatted in, not even a question, but just some feedback that they were seeing within their communities. Just the amount of disposable spend that you are using, I'm sure, is causing some cost increase. One individual had shared, so thank you for that, that they were sending meals home for their staff. So they were using a lot more disposable containers to help support that. So thanks for the dialogue and helping keep us engaged with you by sharing some of that insight. As that poll is coming in, I have one kind of final piece of data to share, and this was really comparisons on PPD pre-COVID and post-COVID. We took a look at all of our DSSI customers. Again, this is across all of the broadline distributors that we use on DSSI and any of the providers that send us PPD. So really, it's a very, very macro view of what we're seeing. But again, really tying in with some of those trends around an increase in the convenience foods. We know sometimes those are a little bit more expensive, so not a big surprise there, that category. So again, those are moving to portion control, pre-prepared, pre-made items like that. Interesting, some of the supplements and dietetic drinks with some of that unintended weight loss, trying to prevent that. Maybe we're seeing some of those increases there. So again, just wanted to share this perspective, but as you can see in certain categories, there was actually a decrease in some of the PPD costs. So there's a little bit of blend going on. Looks like a lot of you are trying to keep it the same where possible, and others just did kind of a general increase on their budget during these times. So with that, that will take us into really the last set of questions here in our final time together. Nick, I think you touched on a little bit around the pricing. I know we only have about 5 minutes left. So with some of those, I know there's a couple of these questions that we may just send out to all the attendees afterwards, because I want to get to our wrap-up question, because I think this is a really interesting one and I want all the panelists to be able to share it. With some of the product availability and price fluctuations, I know some of the providers have had to get a little more creative with their menus. And so from each of you, being some of their strategic business partners, really working as distributors, manufacturers, Barb, your expertise in menus, can each of you share some best practices or tools you may have or recommend to them to really help educate their family members, maybe why they're using a lot more ground turkey than they normally have, or ways to make it exciting for their staff or their residents maybe if they don't have as wide of a variety as menus. So Barb, I know we haven't let you chime in here in a little bit, so why don't we start out with you for this final question?
Sure. I think that's there's been a lot of great things said already, but I think the menu itself, as far as finding those, I mean, everybody has you chimed a little bit in on cost there. You know, our focus has been trying to still create that quality experience for the resident, but looking at what the supply chain has to offer. So, you know, we have really looked at recipes that incorporate, you just said it, ground turkey instead of ground hamburger, let's say, when those supply was down. You know, understanding that it doesn't have to be prepackaged items. There can be simple, good recipes because we understand that labor is an issue. So reach out to your resources. I guess that would be my recommendation. There have been a plethora from all of us, manufacturers and distributors alike, a lot of resources at your fingertips through probably your ordering platform that touch on these menu development issues to be able to help you move forward and not really, I guess, continue to create that dining experience that creates those great nutritional outcomes that we talk about.
Nick, I will go to you next. Can you share maybe some fun tips or tricks or resources that may help educate residents or staff for kind of spicing up the menu with some of those products maybe repeating more frequently?
Absolutely. So yeah, I asked my team or some of my team what they thought, and one of the big ideas that I liked was plant-based items. Now that's such a great trend, and they can give you a lot of recipe ideas that you can use and something different so you don't get flavor fatigue. So that was kind of the big idea that came from my group. I know we're short on time, but I'd add something, but I'll let Scott have a chance.
All right. Well, Scott, thanks, Nick. We'll let you wrap up that question.
Yeah, I'd end with just saying if you go to, as a resource, if you go to TysonFoodservice.com, we do have a newsletter that we send out. Now it is monthly, but you can sign up for it. It's got all kinds of information and insights and trends and what we're seeing taking place through COVID that can help operators. And it does expand across all channels, but it's really good insights and information that I think that you could utilize. So that's a resource that could be available and could be used.
So that wraps up our time, but I am getting some just comments coming in. And again, really love that the attendees are chiming in with some things that have worked well for them. I probably won't be able to summarize them all, but some thanks for the creative ideas. Someone loved the plant-based ideas. Scott, they thought it was really creative how Tyson was creating some of that social distancing in the cafeterias at the Tyson plant. Other folks have really shared some other ways that they're using disposables and where we saw some of those fluxes in PPD costs. Someone had mentioned that they're doing hero meals, allowing their staff to take meals home and using more disposables. I think these are all really great topics. We do have the topics set for our next webinar. That one is going to be on infection prevention, but we're also planning on doing a webinar in October and November. So I know we touch on a lot of topics with menus and pricing and product availability and how we're doing that. So I think we'd love to get into a deep dive. So I'm going to make note of some of the folks who made comments in the chat and reach out. And again, please join us on September 24th. We'd love to see you back for some more engagement for our next Dining Executive Council webinar.